Do my hand hygiene. Hi, my name's Ava. I'll be your student nurse today. Could you confirm your name and date of birth?
Hallie Rubin, 12/03/2004.
All right, this matches your wristband. Do you go by Hallie?
Yes.
Okay, awesome. Do you have any allergies?
No.
Okay, and what's your, can you tell me where you're at today?
I'm at the hospital.
Great, and can you tell me what year it is?
It's 2025.
Perfect. So today we're going to be doing a head-to-toe assessment, listening to some GI, cardiac, lung sounds. Does that sound good to you?
Yes.
All right, perfect. I have a few other questions for you. But first off, what brings you in today?
I've been having headaches for a few days.
Okay. You said a few days, so it started recently?
Yeah,
okay.
a week ago.
And where is this located? Can you show me where?
Kind of at the front of my head by my eyes.
Okay. And how severe are these? 0 being no pain, 10 being the worst pain you've ever felt. How would you rate them?
Around a 5 or a 6.
Okay, gotcha. So how have you been managing these headaches? What makes them feel worse or better?
I've been wearing headache hats, like ice packs to help them, and bright lights make them worse.
Okay, got it. Well, I just have a few other questions before we start the assessment. Can you tell me your gender identity?
Female.
Okay, and was that your sex assigned at birth?
Yes.
Okay, and are you on any current medications?
No.
Okay, tell me more about your past medical history. Oh yeah, I also can show. I just wrote these down to remember them, but just the questions. And have you had any recent surgeries or hospitalizations?
No.
Okay, and do you have any chronic or genetic diseases of your immediate family?
No.
All right, I just have some lifestyle questions. Do you smoke?
No.
Do you do any recreational drugs?
No.
Do you drink alcohol?
No.
And then do you feel safe at home?
Yes.
Okay, so we can get started with the assessment now. I know you said lights are making your headaches worse, but I am gonna have to use it, so just let me know if it aggravates it at all. But could you just smile for me, raise your eyebrows, perfect, symmetrical. Now I'm gonna go ahead and shine the light. You can look at the tip of my nose. Perfect. Tip of the pen. Go. All right, pupils are equal, round, and reactive to light. Now, could you say ah for me? All right. Mucosa's looking good. It's pink and moist. Now I'm gonna go ahead and start with your upper extremities. So first I'm going to just feel the temperature of them, checking the color, any signs of cyanosis or anything like that. Then you can just relax them. I'm gonna go ahead and listen to your pulses. All right, those are 2+, easy to palpate bilaterally. And now I'm gonna check your cap refill. All right, less than 2 seconds, and check for skin, turgor, no tenting. Have you been drinking water?
Yes.
Great, staying hydrated. Now can you go ahead and squeeze my fingers? Perfect, nice strong grip there. And now I'm gonna go ahead and start your lung assessment. Have you been having any shortness of breath? Right, inspecting the thorax. Right, no signs of labored breathing and symmetrical chest. Gonna go ahead and listen. Actually, first I'm gonna palpate. So just let me know if there's any tenderness. Everything feel good?
Yes.
All right, gonna go ahead and give a listen. Just take a deep breath each time I move the stethoscope. Perfect. All right, breath sounds were clear. Now I'm gonna go ahead, since we're at the front, I'm just gonna listen to your heart sounds as well. All right, I heard S1, S2, no extra sounds. I'm going to also listen with the bell side. All right, same thing, S1, S2, no abnormalities. You can go ahead and turn around. I'm going to go ahead and listen to lung sounds on your back and palpate again. Let me know if it's tender anywhere. All right, it's going to go ahead and give a listen. And this would normally be under a gown. All right, clear lung sounds. You can go ahead and lay on the bed. We're going to start the GI assessment. All right, have you been having any trouble passing gas? Have you been passing gas?
Yes.
Okay, and can you tell me when your last bowel movement was?
Last night.
All right. So I'm gonna go ahead and just inspect again. This would be under the gown. Look for any abnormal masses or abdominal distension, but the stomach looks flat, no signs of abnormalities. I'm gonna go ahead and do a listen to each quadrant and just relax. All right, I heard a bell sound in all 4 quadrants. Now I'm going to use the bell and listen for any signs of an abdominal aneurysm, aortic aneurysm. All right, it's looking all good. Now I'm just going to palpate again. Tell me if there's any tenderness. All right, looking good. No tenderness or pain.
Correct.
All right, well, you can go ahead and sit back on the chair, and we're going to do the lower extremities now. All right, again, I just start off by assessing the color and the temperature, feeling nice and warm, no signs of cyanosis or anything like that. I'm gonna listen to the tibial, or palpate the tibial and PDS pulse. Those are both 2+, easy to palpate. Go ahead and push down on my hands, then up to the sky. Perfect. Now I'm gonna go ahead and check cap refill on your toes. Right, less than 2 seconds. And I would also check for edema. No swelling, no signs of edema. And yeah, I think we're all set here. Good to go. Just gonna check one more thing, your reflexes. So you can just relax. Perfect, that was 2+, normal. Right, same with that one. Do you have any questions or concerns for me, Hallie?
No.
Okay, great. Well,
Thank you.
thank you. We'll see you soon.